Hello everybody, my name is Ben Monk and welcome to the workshop today. This is a great training. This is called a lay rescuer training, and when we talk about lay rescuer, that's you and I. So that is anybody outside of the official emergency responders. And so this workshop today is going to be about opioid abuse and specifically responding to opioid overdose with the use of a life-saving medication called naloxone. So the objectives today that I hope to cover are to understand the vital importance of this workshop first and foremost. As we know, there is a devastating opioid epidemic in the United States right now, and so there has never been a better time to be trained on how to respond to an opioid overdose victim if you were ever to be around one. Also to understand addiction as a chronic illness, to understand how opioid overdoses happen and how to recognize them, to understand how naloxone works, to identify risk factors that may make someone more susceptible to an opioid overdose, and finally we will learn how to respond to an opioid overdose with the administration of naloxone. So making the case for naloxone education, as I mentioned, the epidemic in the United States right now is absolutely crazy, and that's no different for the state of Virginia from where I live. So since 2013, fatal drug overdoses has been the leading method of unnatural death in Virginia, surpassing all other forms of unnatural death, including homicide, suicide, motor vehicle accidents, and undetermined deaths. In 2018, there were 1,213 deaths from all opioids, which includes all versions of fentanyl, heroin, prescription opioids, and synthetic opioids, such as U47700. So right now there is what's called a standing order at all pharmacies in the state of Virginia, and that means anybody can go into a pharmacy and purchase naloxone without having a prescription from a doctor. But before you do that, contact your local health department. You can usually get it for free there. Usually you can also get it from your community services boards in your city. Usually they have it at no cost. If you can't get it at either of those places, then contact your local pharmacy and see if they have it in stock, and then you can run it through your insurance, and you'll usually have an out-of-pocket payment. Understanding addiction. Something that's really important about this workshop is to get rid of the stigma that's associated with addiction. So people don't plan to get addicted to drugs. Many people think, well, if you don't want your life to be ruined, then stop using, or just put down the drugs or whatever it may be, put down the bottle, whatever it may be. And it's just not that easy. When people first take a drug, they might like how it makes them feel, and they think they have control over it. They think they have control about how often they use it. But what happens is drugs take away people's control, and they actually change your brain physiologically. So when talking about the clinical diagnosis of addiction, this refers to substance use disorders at the severe end of the spectrum, and it's characterized by a person's inability to control the impulse to use drugs, even when there are negative consequences. So this is a person who has their spouse is filing for divorce, they've lost their job, they're in financial turmoil, they are breaking the law, they're stealing, things like that, and they continue to use no matter what. They steal something and they sell it to get money for drugs, and they continue to use, they continue to have this inability to control the impulse to use drugs, and that's when we refer to that as a clinical diagnosis of addiction. I want to show you part of this video here, and it just kind of gives an illustration of what happens to somebody when they get addicted to opioids. So you can see there, again, that's just a cute little illustration of, it's a good illustration of how your brain, you lose control, and you want the feeling so bad, and no matter what's happening in your life, you just continue to chase that high. So what is an opioid? Opioids are a class of drugs that include heroin, synthetic opioids, and pain relievers available through prescription. So some that you may be familiar with, that you may have been prescribed by a doctor from surgery or from an injury, or hydrocodone or Percocet, oxycodone, maybe morphine, those types of medications. Again, those are prescribed for pain. What is an opioid overdose? So the purple, in the purple there in the illustration, represents the opioid receptor in the brain, and we have many, many opioid receptors in our brains. So when we take an opioid, which is represented by in the green there, it fits exactly into the opioid receptors. If we have too much opioids in our body, then they're filling up too many opioid receptors, then it slows down our breathing very, 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 very much, even until it stops our breathing. And that's exactly how opioid overdose happens. So risk factors for opioid overdose. So these are some people that may be more susceptible to overdose, and those are those with prior overdose, those who have a reduced tolerance. So maybe somebody who has been in jail and then they've gotten out and they thought they could use the same amount that they did before. That happens quite often. It's also, you're more susceptible also if you're mixed drugs, such as combining with alcohol or stimulants or depressants. Also in variations of strength. That's particularly true with heroin. You're getting it off the street where it's made who knows where, and so you don't exactly know how powerful it is. And also underlying medical conditions such as chronic disease or kidney or liver problems. So signs of an opioid overdose. The main thing here is about 4 down, is unresponsive to stimuli. That is the main thing here. Usually if somebody's really high, you can call their name, you can shake their shoulders, you can give them a sternum rub, and usually they'll wake up. But somebody who's overdosed is unresponsive. Naloxone is the only effective response to an opioid overdose. So some people think, well, maybe you just can pour water on them, or slap them, or kick them, or inject them with something, and things like that. And none of those things work. In fact, they're very dangerous. Naloxone is the only effective response to an opioid overdose. What is naloxone? Naloxone is a medication designed to rapidly reverse opioid overdose. It comes in 3 forms: the injectable form, which is like an IV, an auto-injectable, which is like an EpiPen, and the prepackaged nasal spray, which is what we will be training with today. So how naloxone works, it literally knocks the opioid off the opioid receptor. Naloxone has a stronger affinity to the opioid receptors, and so it knocks those opioids right off, which allows the person to breathe again normally. There are no real serious side effects from naloxone. They're very rare. Naloxone does not reverse overdoses from other drugs. It only reverses overdoses from opioids. Naloxone has no abuse potential, so somebody can't become addicted to it. And naloxone has the same dose for an adult or a child, so whether you're responding to either one or the other, it's the same dose. So now that you understand what opioids are, how they can cause an overdose, what naloxone is, and how it works, it's time to learn how to save someone experiencing opioid overdose. So I'm going to open up the screen here a little bit, and we'll talk about responsiveness. So when you are helping somebody who has possibly overdosed, then you'll want to call their name really loud. Hopefully they'll respond to that. If not, you give them a sternum rub right in the middle. You can put your ear down by their nose and listen if they're breathing. You can feel their pulse, and you can feel their pulse to see if that's breathing. The next thing you want to do is call 911. So that will be another person, preferably that's around, to tell them to call 911 immediately. If it's just you, you call 911 with your phone, put it on speakerphone, and put it next to you. Those 911 dispatchers will be a very, very valuable resource for you. You want to listen to them carefully. The next thing you want to do is what's called rescue breathing. So you'll give the person 2 rescue breaths. And the way you do that is when a person is laying down, you want to put them on their back. And when they're laying down, they're going to be somewhat like this. And what you want to do is you want to open up their airway, which means you put your fingers here and you push up like that, and that opens up their airway. And then what you do is you squeeze their nose and their airway is open, and you give them 2 breaths right into their mouth. And this is going to be regular breaths. This is not forceful breaths, but you want to look out of the corner of your eye to see if their chest raises just a little bit. Then you want to administer naloxone. Now this is naloxone right here. This is the nasal spray. And what you'll do is you'll take it like this with the fingers and your thumb down here, and you'll put it right to their nose and give 1 spray right into the nose. Usually they'll respond within 3 to 5 seconds. It usually happens very quickly. Then you'll want to continue to do rescue breaths and listen to the 911 responder and listen to what they're saying to you. After this, there's 2 cases where you may need to give another dose, and that's if they haven't responded or if it's taken too long for the emergency responders to get there and they've actually relapsed into another overdose. So aftercare, you want to keep them calm. If you have to leave them, then you want to put them into a recovery position, and that's this position here with the leg out, with the hand under, supporting their face, and this is just in case they happen to throw up or happen to vomit. Thank you so much for attending the workshop today. I really had a great time. I hope you guys learned something, and have a